Hey guys, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. So today I'm going to get into labor and delivery, okay? And we're going to talk about the 3 stages of labor, all right? So again, these are key points, guys, key elements to try to refresh your memory, motivate you to look further, to research further, and to study further, right? But it's important that you do this, and it's not just for the exams. I say this every week, that this really is, it's key information to help you get through your exams, right? But it's also designed to build your knowledge base, to encourage you to build your knowledge base, to make you make better decisions, become a better clinician out there in the field, fill out your ambulance corps reports better, and interact more efficiently with other healthcare providers. Okay, keep that in mind when you're watching these videos. It's not just about getting the stuff to go pass your test. Anyone could be taught to pass an exam. It's after that really counts. Okay, it's after that. All right. Let me give my high horse. Let's get on with this, guys. So, 3 stages of labor. First stage, we're talking about that dilation, right? It's the beginning of the regular contractions to complete dilation of the patient's cervix. Okay, about 10 cc's. This can average 2.5 to 7 hours, sometimes even longer, right? It depends upon how many babies the patient's had and stuff like that. But average, we're talking 2.5 to 7 hours on how long they'll be in this first stage. Now, the second stage can be like 8 minutes to 30 minutes, right? But this is the part where the baby actually is born. This is the delivery. Okay, now keep in mind, guys, if the baby's going to get delivered, if they're crowning, all right, that means it's coming. So don't transport. It's much easier to deliver the baby in the house, okay, even on the street or in a hallway, whatever. Much easier to do that than trying to do it in the back of a moving ambulance, okay? So don't transport his birth is imminent. Go ahead and have the baby there, situate yourself, prepare, and then you can prepare for transport and get going that way, okay? Now, when the baby's coming, you're going to have those contractions. It's going to be less than 2 minutes apart. This is when it's on the way, right? Less than 2 minutes apart. They're much more frequent, all right? And the patient's going to have that really, really intense urge to push. They're going to want to push. They're going to want to feel they're going to the bathroom, okay? Now, talking about crowning, all right? This is when the baby's coming, okay? It's on the way. You can't do anything about it at this point, right? So some things to just keep in mind when you're delivering the baby, okay? Try to keep a gentle back pressure on the patient, on the baby as it's being delivered to prevent an explosive delivery. All right, that's going to also help you prevent tears to the perineum. All right, sometimes you might have to manually rupture the amniotic sac. All right, so be prepared for that. Most OB kits have something that you can go ahead and rupture the amniotic sac with, okay? As the head delivers, keep an eye out for the umbilical cord, all right? If you see it wrapped around the baby's neck, go ahead and simply slip it over the head. Most of the time, it's very easy to do that, so don't panic if you see it there, okay? Suction the mouth first and then the nose, all right? Try to do it if you can before the chest is delivered, all right? A lot of times the babies won't take their first breath until the chest is actually delivered, so get the suction going before then so they don't breathe anything in when they take their first breath, okay? And try to get the head down a little bit, right? Kind of angle it down a little bit to help with that drainage, help getting the fluids out, okay? Support the head all the time, guys, all right, when the baby is coming out and as it's rotating, okay? And when we talk about clamping the cord, you want to go 4 inches from the baby, about 6 inches from the mom, and cut between those clamps. I've seen people do it where they clamp it good, but then they cut the cord for some reason on the opposite side of the clamp. So pay attention, cut it between the clamps, and get your APGAR score, okay? You want to go ahead and do it 1 minute after delivery and then 5 minutes after delivery. And don't forget as well, record the time of delivery, okay? Now, talking about APGAR, I don't want to go into it too much here. Just some key elements here you want to keep in mind, okay, when you're thinking about APGAR, all right? Keep in mind, everyone's not going to be a red. Everything in red and all your newborns are not going to all be in a green, okay? So when we talk about this list of things you can look for, people, they're going to jump around. The baby might be a little pale, but they're going to be good on the other side, in the red end. They're going to be actively moving and maybe crying very good, right? So you want to get that score going on, okay? So go ahead and make sure you add that stuff up. It's hard to remember this stuff. I know that. Keep an image like this on your phone. There are apps out there you can download as well to make it easy to recall this stuff. Don't make it difficult, okay? There's enough going on. Don't make this type of stuff difficult, okay? Talking a little bit about the third stage. Not much we're really doing with this. We're going to be waiting for the placenta to deliver. It takes about 5 to 20 minutes for that to actually happen. Don't pull on the cord to try to help it come out, okay? But at the same time, don't delay transport. Get going with the baby. Wrap it up. Keep it warm. Okay, monitor the mom. Monitor the baby. Don't forget about mom, right? You got 2 patients now. So don't forget about mom. Watch for bleeding, stuff like that, okay? Wrap the baby up, keep the baby warm, maybe blow by oxygen, whatever the case may be, whatever your protocol actually calls for. All right, now, if the placenta does deliver, take it with you to the hospital. All right, put it in a plastic bag, a red bag, or some type of container, okay, so they can inspect it at the hospital, okay? Now, talk a little about postpartum care. You might want to massage your uterus a little bit. That's just kind of massaging the mom's belly a little bit. Okay, that's going to help slow down the bleeding, kind of control the bleeding. But keep an eye out for blood loss. All right, if you see something more, if there's a lot of blood loss, maybe 500 milliliters after the mom delivers, that could be cause for some issues, something going on that you're not seeing. Okay, like I said. Now you got 2 patients, right? Baby might be great, might be pink, might have a perfect APGAR score, right? But maybe mom's not doing so well. Maybe there's some bleeding going on. Okay, maybe there's some additional pain that you didn't expect going on. Keep an eye out for that, guys. You got those 2 patients, okay? Now, I'm going to go ahead next time. I'm going to end this here, guys. Next time I'm going to talk about abnormal presentations, okay? And kind of wrap up labor and delivery. All right. In the meantime, guys, I hope you engage with me. Join me on these social media channels on Twitter, on Facebook, or on Instagram. Very easy to find me there. Just put in the EMS Professional on Facebook, or I'm at EMS Safe on Instagram and at EMS Safe on Twitter as well. Okay. All right, guys, that's it for me. I hope you enjoyed these Monday Minutes. If you've got some of your own you want to share, go ahead and send me an email. It's contact@emsofficehours.com. And be sure to go to the website. If you're watching this on YouTube, thanks for joining me here on YouTube. Make sure you comment here and review this video. But at the same time, go to the main site at emsofficehours.com. A lot of great content there as well. Not just these videos, but other great the podcast is there. Some free stuff is over there. Lots of cool stuff there, guys. Go check it out on the blog. And as always, go tell at least one other person. Tell one of the EMS professionals you know about these. I think everyone can kind of learn a little bit, get a little takeaway, and build that knowledge base, right, for when it's important out in the field. All right, guys, that's it. As always, Jim Hoffman for Monday Minutes. Stay safe.